Chelsea, my name is Bonnie. I'm going to be your nurse practitioner student today, and we're going to do a physical assessment, okay?
Sounds great.
All right, perfect. I'm just going to go wash my hands real quick.
Okay.
Okay? All righty. So, we're going to start with a head-to-toe assessment, okay? Do you have any questions for me before we start?
No, ma'am.
Good. Okay, I'm going to start by feeling your head and your scalp, okay? Is there any tenderness in here?
No, ma'am.
If at any time during this exam you do feel tenderness, let me know, okay?
That sounds great.
Okay, perfect. Okay. All right, have a look at me. I'm just going to palpate your sinuses here. If you feel any pain in there?
No, ma'am.
Good. Okay, you can open your eyes. Okay, I'm going to check your eyes.
Okay.
Again, we're just going to shine a light in here. Just look straight ahead.
Okay.
Okay, straight ahead. Perfect. Okay. So, follow my finger, if you will. No, without moving your head. Look like that cross-eyed there for a minute. Okay. And if you will, just hold this chart for me. Read the lowest line you can, cover one eye.
937826.
Good. Now cover the other eye.
937826.
Perfect. Okay, I'm going to look in your eyes. Okay, I'm just going to hold your head so I don't get too close. Look up here. Very good. Okay, so I'm going to check your peripheral vision. Okay, tell me when you see my hands.
No.
Okay.
No. No.
Good, perfect. Okay. While we're here, we're going to, I'm going to touch you with something. I want you to close your eyes and tell me whether it's sharp or dull.
Start. Go. Start. Go. Start. Go.
Very good. Okay. Close your eyes real tight. Open them real wide. Puff out your cheeks. Good. Smile real big. Clench your teeth. Perfect. Okay. All righty. I'm going to check your ears. Before I do that, let's just have a look down here. Conjunctiva square. Good. Okay. All right, I'm going to put something in your ear. First, I'm going to feel around here. Okay. Is this painful at all?
No, ma'am.
Okay. Have a look in. Good. Good. Any pain in here?
No, ma'am.
All right. I'm going to palpate around your face, facial muscles. Any pain?
No, ma'am.
Open and close your jaw for me. Okay, good. Have a feel your neck. Feeling your lymph nodes, okay? I'm going to go back here. Is any pain or tenderness?
No, ma'am.
Okay. I'm going to go around here and I'm going to feel your thyroid.
Okay.
Swallow for me. Good, everything feels good there. Okay. Okay. I am going to have a look in your mouth. Okay, I'm going to get a glove.
Still going.
Do you have any trouble smelling?
No, ma'am.
All right, and before I go to your mouth, I'm going to look up your nose. Okay. Good. Everything looks good up there. Just occlude one nostril for me. Good. Any trouble smelling through there or breathing air? Okay, good. And the other one? Perfect. Okay, open your mouth for me. Okay. Good. Okay, everything looks good in there. Okay. I'm just going to feel around inside your mouth for a minute. Okay. Okay. All right. I am going to listen to your carotid artery. Okay. All right. So just take a deep breath and hold it. Okay. Breathe. And take a deep breath and hold it. Or just a breath and hold it. Good. Okay. I'm going to have a listen to your heart. Can you move the breast for me? Thank you. Any pain or tenderness in here?
Mm-hmm.
Feel your apex of your heart right down here, okay? Okay. I'm going to go around and I'm going to listen to your back, and then we're going to lay down and do the rest of our cardiovascular assessment. Good. All right. Tell you what, let's do this first. Say 99
99,
again
99,
and again.
99.
Okay. Every time I move my stethoscope on you, just say 99 for me, or take a deep breath. Okay, say 99.
99,
Again.
99, 99, 99, 99, 99.
Now say E.
E, 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 E.
Good. Okay. All right, so we're going to look at your percuss this, okay? Okay, take a deep breath and hold it. Okay, let it out. Good. Okay, take another deep breath. Hold. Okay, let it out. Don't breathe. Good. Okay, that's equal. Okay. so I'm gonna have you lay down and I'm gonna listen to your heart, okay, in that position. Okay, take a deep breath. One more. One more. Okay. Okay, and lay on your left lateral side. And I'm gonna listen here too, okay? Any pain? Lay back on your back, okay? Okay, wanna hoist yourself up like that a little bit? We'll look at your, there you go. Looks good. Look at me this one. Okay, and right flat, yep. Okay, can I pull your shirt up?
Yes.
Okay. All right, I'm gonna listen to your belly. Normally I'd listen in all four quadrants for a minute, but I hear good vowel sounds. And I'm gonna listen to your arteries under here. Now I'm gonna push on your belly lightly, okay? If you feel any pain at any time, let me know. No pain? Any pain back here?
No.
And what about this side?
No.
All right. So, I am going to take a minute to step backward and test your hearing one time quick. Okay? Okay, I'm going to put this thing, I'm going to hit this thing, I'm going to put it in the middle of your head. I want you to tell me whether you hear it or not. Okay? Or whether you can.
It's equal.
Okay, good. All right, now I'm going to put it back on your mastoid bone on each side. When you stop hearing it here, or stop feeling it there, let me know. I'm going to move it.
Mm. Mm.
Thank you. All right. Let me just see your hands. Put your hands up this one. All right, move your fingers up like that. Come on, back again. Move them down. Move them up. Make it fixed. Good. Go round and round. Any problem moving here? Any problem with range of motion there?
No.
Okay, now I'm going to look at your knees. Okay. Any problems moving these?
No, ma'am.
Okay, any pain in there?
No.
Okay. Feel for a pulse back here. Does that tickle?
I'm okay.
Okay. So here. Let's bend this too. Okay. And move your ankles around for me. Okay. Good. Okay. All right. Do you have any questions for me?
No.
All right. If we were going to continue this exam, we would be examining the female breasts, which we would have the patient sit forward, shoulders hunched. We would examine them for size, symmetry, color, any retractions or dimplings. I would then have them lay down, and I would examine again for the same things: symmetry, retractions, dimplings, any kind of nipple discharge, color, and I would do a manual breast exam. We can do it either in a concentric circle pattern or a strip up and down strip pattern. To do a genital exam on a female, we would have her assume the lithomy position. We would inspect the external genitals for hair distribution. External for any kind of lesions, any kind of growths, a discharge. We would then do an internal examination with a speculum. We would look at the vaginal walls. We would look at the cervix for color, shape, cervical motion tenderness, and any kind of discharge. In a male, we would inspect the scrotum, the penis, the epididymis, the glands. We would look for discharge, the urethral meatus as well, in both sexes, for any discharge, any tenderness, any inflammation. We would inspect the testicles for inflammation, any kind of growths or masses, and of course, the normal hair distribution pattern. We would do a rectal exam as well. In a male, we would be inspecting the rectovaginal wall, the walls of the rectum. We would palpate the prostate, and we want it to be firm but still pliable, and have no growths or nodules on it. In a female, we would inspect the rectum. We of course want to look for sphincter tone as well. We would inspect the rectum. For tone, we would then insert our finger. We would look at the rectovaginal. We would make sure there were no tears or fissures there. We would palpate for any nodules within the rectum. And if a patient, it depends on the position that the patient is in, we could possibly feel her uterus. And a male, for the positioning for a rectal exam or for genitals, we could have them either be standing or sitting, whichever is more comfortable for them. For a rectal exam, we're going to place them in either in a knees to chest position or in a bent over a bed or a table.